My name's Maggie. I'm one of the speech language pathologists that works at Genesis, part of the inpatient team. The majority of the patients that I work with include the geriatric population, anywhere from strokes to brain injuries to traumatic injuries. We experience patients who have difficulty with their memory and they think it's just normal aging and that there's really nothing to do about it. And actually, speech therapy can heavily focus on memory, part of the cognition, and therapy, no matter how significant the deficits are, can always help to try to improve, whether it's through family education, compensatory strategies at home, or just working on the areas that bother them the most. The hemisphere of our brain that involves our language is actually the left hemisphere. So anytime there's a stroke in that area, particularly the Wernicke's area, patients have a lot of difficulty communicating, almost word finding difficulty. And that can be either getting the words out or really understanding what is being said to them. A stroke in more of the back part of the brain can affect vision and balance. And a stroke on the right side of the brain can really affect a variety of things. And interestingly enough, patients who have strokes on the right side of the brain often aren't super aware of their deficits. And then a stroke in the frontal lobe of the brain can sometimes affect planning, organization, personality. If they are an outpatient or at home and they're interested in speech services, they would speak to their primary care physician, discuss how they would like to see a speech therapist to address any of the concerns they're having, and the primary care physician can send a referral. And that way they can get in contact with us, schedule an outpatient or a home health visit, go from there. If they are an inpatient, if families recognizing some issues and speech isn't consulted yet, just simply say something to the nurse or to the physician when they're rounding, and they can call us and get us on board. A lot of what the speech language pathologist does with stroke patients does involve swallowing. About 50% of patients who have had a stroke do have some sort of difficulty eating and drinking safely. Sometimes we have to modify their diets by thickening liquids or by pureeing their foods, cutting their food into small pieces. And a lot of times this affects the patient's quality of life. They no longer look forward to meals, they're not eating very much. And so some of my bigger successes involve helping to rehabilitate a patient to their normal diet. So allowing them to get back to eating and drinking whatever they want safely, and that way they can enjoy mealtime again.